afternoon. Today I want to speak to you about the developing situation in Wales, about what's happening now and what could happen in the weeks and months ahead. As the First Minister said on Friday, there is clear evidence that coronavirus is waking up for the winter. The virus is now present and spreading in every part of Wales. Now, this map on screen now shows the current spread of coronavirus in Wales. The darker the area, the higher the 7-day incidence rate. The darkest areas have an incident rate of more than 100 cases per 100,000. These are clustered in parts of South Wales and the 4 counties in North Wales with whole county restrictions. The lightest areas have an incidence rate of less than 50 cases per 100,000, and these are largely in Wales's most rural areas. The All Wales incidence rate is now more than 100 cases per 100,000 people. We have seen coronavirus move from east to west across the UK, and likewise from east to west across Wales. This is why the latest area affected is Bangor, as coronavirus has moved swiftly across North Wales. There's been a surge of cases in the city, associated largely but not wholly with younger people and the student population. Local restrictions were introduced in the city on Saturday night. We're closely monitoring the wider situation in Gwynedd and in neighbouring authorities. We will meet local leaders to discuss the situation early this week. The measures that we have put in place at both the local and national level to date have helped us to keep the spread of the virus in check. However, there is growing concern that these will not be enough to help see us through the winter because the virus is spreading so quickly. We could see coronavirus infections reach the same level as the spring peak in the next couple of weeks. This week, we expect to see tougher measures introduced by the UK government in the hardest hit areas of England and a new 3-tier intervention system to help it control the spread of the virus. This morning, the First Minister and myself discussed these measures at a COBRA meeting chaired by the Prime Minister. And in Scotland, the very strict firebreak measures, which include the closure of hospitality businesses, came into force over the weekend and throughout the Central Belt. I do not want to scare people, but I do want people to understand that we potentially face a very difficult few months ahead of us. I want to run through some of the figures and some slides with you which will explain why we are taking the current situation so seriously. As I said earlier, the latest figures show the 7-day incidence rate for Wales is now more than 100 cases per 100,000 people. The first graph shows very clearly how cases have risen sharply since the end of August in Wales. We have more than 600 new cases of coronavirus confirmed on many days in the last week, a region of 10,000 tests a day. This slide also shows in the second graph a clear increase in the number of deaths since the summer, when there were long periods when no people died from this virus. Remain with everyone who has lost a loved one during this unfinished pandemic. Very sadly, we know that more people will die from coronavirus this winter. The results from the Office for National Statistics' latest infection survey suggests that 1 person in every 500 has coronavirus in Wales. The R number is now estimated to be at around 1.37. The number of people with coronavirus in hospital is increasing steadily. There are more than 330 people with coronavirus in hospital across Wales. That's up by more than 100 from last week. There is about a 2-week delay between cases in the community and hospital admissions. As we see cases rise in the community, we can expect to see a corresponding increase in people admitted to hospital and to intensive care. We're seeing a steady increase in the number of people who are seriously ill and need intensive care treatment, including for coronavirus. The NHS is implementing its plans to increase critical care capacity, transforming theatres and recovery areas into intensive care settings to treat the most seriously ill people. 2020 has been a difficult year. We have all been through so much already, but we must be prepared for a difficult winter ahead of us. Coronavirus is moving quickly through the UK and in Wales. It is a highly infectious virus. For most people, it will cause a mild illness, but we know a significant number of people will need hospital treatment, and sadly, some people will die. We also know some people will experience after effects long after they have recovered from the illness, sometimes known as long COVID. Now, more than ever, we need to act together to keep Wales safe. Thank you. I'll now take questions from journalists. As always, we'll broadcast all the questions and answers live on our own social media channels. The first question this week is from Owen Clark from BBC Wales.
Prynawn da, Health Minister, good afternoon. Given what you've just told us about the growing concern that the measures we have in place now won't be enough to see us through the winter, is it time for you to perhaps level with people to suggest that we will need to think or move into a national lockdown in Wales sooner rather than later? And what's on the table with that?
Well, as I said this morning, we are considering all measures, whether we maintain local restrictions or whether we move to a national picture, and what that national picture might be. You will have seen the well-advertised conversations and suggestions about having a fire break or a circuit break, as Scotland have introduced, and we're obviously considering all of those options here. We need to understand what might be required and what we might need to do, not just at that period of time, but what might come afterwards. Now, we haven't made a decision on that. We're continuing to have those conversations here in Wales with our scientific advisor and the Chief Medical Officer's Department, but we know that that is consistent advice that is being given to all governments in the UK to consider. So in Wales, I think this will be a particularly important week as we look to not just have conversations, but we will then need to make decisions through the rest of this week.
Thank you. Given the very worrying pattern of disease spread in communities quite close to our borders, what is the latest thinking in terms of restricting travel of anybody from England into parts of Wales with lower incidence? What's the latest thinking on that?
Well, myself and the First Minister will be meeting again later today, but we're both deeply disappointed that the Prime Minister is still taking an approach where there is only going to be guidance on whether people should or shouldn't travel out of highly infected areas. Now, this isn't just an issue for Wales, an issue for the whole UK. Lower prevalence areas in England will be equally affected, as indeed lower prevalence areas in Wales. And we do understand that there has already been an importation of coronavirus cases from contact with some of those high prevalence areas in England. So we will meet later today and we will then need to make choices, given that there doesn't appear to be a resolution on this with England-only measures, which would have been the right choice to make about those very high prevalence areas where we all expect there'll be further action taken today and over the next few days. But sadly, the Prime Minister has chosen not to act. So we will be making choices here in Wales. Thank you. And I've now got Adrian Masters from ITV Wales.
Thank you, Minister. You mentioned the three-tier system that the Prime Minister is expected to announce for England later. Are you considering a similar system for Wales? And if not, why not?
Well, we're considering the three tiers that England are producing, but we're not clear about the metrics, the measures that will be used to understand how people move between the three tiers. So we'll be watching with interest what the Prime Minister does have to say, because we didn't get clarity on that in this morning's COBRA meeting. It's also clear, though, there'll be measures beyond Tier 3 as well. And as I said in the script, We understand that some parts of England will have additional measures put in place that go beyond Tier 3. And it's also clear that the advice that we are receiving from our own Chief Medical Officer's Department, from our own Chief Scientific Advisor on Health, is the Tier 3 measures as we understand them in England won't be enough to bring the R number below 1. So we are going to have to think about additional measures beyond that, just as England are having to consider. And as I say, we expect some of those measures to be announced locally or regionally in England later in the day.
Thank you. Many people who were shielding until August the 16th are understandably anxious and uncertain about the situation as it is now. Should they think about shielding again? Are you likely to advise them to shield again? And if so, what support would you offer?
I have a further conversation to look at some advice from our own Chief Medical Officer Department here in Wales. We also know that there have been conversations between the 4 Chief Medical Officers Departments in the UK. And as I said before, we understand some of the protection that shielding gave to people, but it came at a cost because there were issues about loneliness and isolation for a number of people shielding. We also know that a medical conditions approach has limitations, as I've said previously. If you look like me, you're at higher risk than people who don't look like me, and that isn't covered in a list of medical conditions. The reality also is that for some people who are overweight, that doesn't necessarily mean that that's covered in a list of medical conditions. And equally, we've seen the virus has had a much, much more significant impact in our least well-off communities. So that well-trodden understanding of health inequalities mapping socioeconomic inequality, and that in itself doesn't map neatly across a map of healthcare conditions. So we're trying to understand how to give advice to the public about how to keep themselves safe and well, and whether we need specific advice for people on that shielded list, or whether actually we need a clearer national message for everyone. But for people who were previously on the shielding list, we'd ask again for people to strictly follow the advice in place on hand hygiene and on not having indoor contacts beyond your limited exclusive bubbles of people. And equally to be very, very clear when going out and about to follow the rules. If all of us did that, then we would expect to see a reduction in the amount of coronavirus circulating, but for people who are previously shielded, it's even more important for that guidance and those rules to be followed. Thank you, Adrian. We've now got Will Hayward from Wales Online.
Thank you, Minister. Exactly how many Welsh care homes currently have cases of COVID, and what parts of Wales are most affected?
I'm not sure I can give you an exact list of all the care homes who have COVID right now, Will, but the latest data that we obtained on the weekend of the 4th of October showed a total of 127 positive cases across staff and residents here in Wales. And with over 1,000 care homes in Wales, I understand that that gives us a prevalence rate of 0.7%.
Okay, so that 127 figure is staff, not individual care homes. Coronavirus is still rising in almost every part of Wales, and either the current restrictions are not strict enough or people are not following them. Which one of those is it?
I don't think it's as simple as that, Will. We understand there are about 22, but I don't know the exact about it because we're thinking about those that are managing confirmed cases. The challenge is whether we have the right balance, not just for care homes, but for the whole public, and about the choices that we make. And equally, we know that we're seeing a lessening in the numbers of people that are following strictly all of the advice that we're giving. Even during the national lockdown that we had from the 23rd of March onwards, not everyone strictly followed all of the rules. So we don't get 100% compliance with all of our rules, whether enough of us are doing the right thing, and whether enough of us are following the rules to help restrict coronavirus circulating more widely and growing more in each of our communities. So it's a balance between the measures and whether people follow them, and it's also about how we persuade people to follow the rules to keep themselves, their families and their loved ones safe. So it isn't quite as strict as it's either the rules need to be tighter or people aren't following the rules. It's a combination of all of those things and the time of year that we're in, because more of us expect to spend more time indoors as the weather's changed. And we also know that the fact that it's colder and damper are good conditions for the virus. People are, I know, tired of the restrictions on the way that we are able to live our lives within the rules. But unfortunately, the virus itself doesn't get tired, and it continues to present a real risk to all of us in every community. Thank you, Will. We've now got Rob Taylor from Wrexham.com.
Good afternoon, Minister. You've referred to being in a meeting where you're deeply disappointed over the travel restrictions in England. The First Minister indicated legal preparations had already been explored. Can you detail further on those options that you'll be considering? Could we see individual English counties or cities named in regulations? And if so, how can that be legally enforced on the border? And finally, can you confirm the decision will now be taken by Welsh ministers and you won't be waiting on Westminster again?
Welsh ministers will be meeting today. As I said in an earlier answer, I'll be meeting with the First Minister to consider the legal advice that has already been prepared. We do have public health powers, and because we can see an increase in rate in particular localities in parts of the UK, we should, if needed, be able to identify those areas where the risk is such that we should have restrictions on travel, and it would not be a reasonable excuse for those people to enter Wales because the risk that they present because of the area of the country that they come from. We have the same restrictions within Wales already, so this will be about travel to and from Wales as well. So we do have powers, but like I say, I'm disappointed that there hasn't been a more definitive response from the UK government to deal with England, because they understand that there is an issue in some parts of England and they are considering additional measures to introduce because of that. And we do know that travel in and outside of those areas has been a factor in the spread of coronavirus to other parts of the UK, including some examples here in Wales.
Thank you. And at this morning's briefing, the NHS England Director has said that Nightingale hospitals in Manchester, Harrogate and Sunderland are being mobilised again. What's the situation in Wales, and are there enough staff and resources to mobilise Rainbow hospitals for COVID quickly if required?
Yes, arrangements are in place to make sure that we can stand up the field hospitals known as Rainbow or Envis hospitals in North Wales. The challenge is, as we see an increasing pattern of cases coming into our hospitals here, we need to react to that to make sure we protect non-COVID activity as far as possible. We are seeing our normal critical care capacity would be pretty full by now, but as I said, we're already seeing a range of areas, theatres for example, and recovery areas, being turned into venues for intensive care to be provided. And we know from colleagues across the border, in the northwest of England in particular, that they are seeing their hospitals become full and their intensive care capacity filling out as well. So we are already planning to make sure that our own field hospital capacity is ready, should it be required, and that does mean staff need to behave in a different way, and it has an impact on the way the rest of the health service is able to manage the normal conditions and normal healthcare treatment. Thank you, Rob. I've now got Dan Bevan from LBC.
Thank you, Health Minister. Good afternoon. On your comments today regarding the next few days being serious on determining whether national measures are needed, I wonder if you could expand on that a little bit. Would a national lockdown look the same as the one that happened in March, or would it look more like the current local lockdowns that we have, just on a national scale, with hospitality, for example, still opening?
Well, if we decided to take national action, we would still have to have final detail of what that national action might look like. A consistent pattern of the current local restrictions across the whole country is of course an option, and as I said earlier, there is clear advice from SAID that suggests that a fire break or circuit break with action that looks a lot more like the March lockdown for a limited period of time is an option as well. Now, we have to consider all of those different choices, and over the coming days we will need to make those choices for what we are and are prepared to do, on the understanding of not just what any restrictions might mean, whether locally or nationally, but what we would then seek to gain from doing so, and what that might then mean after any restrictions come off being enforced. Because the circuit break or fire break suggestion is to get ourselves some time to then have a different pattern of behavioural controls and rules in place afterwards. Now, we need to run through that to be able to tell people any choice we make, whether locally or nationally, what that choice is, so there's clear communication about it, what we expect to gain from doing so, what we expect the new rules to be after those measures are no longer in force.
Thank you. And it's been reported this morning that there's another meeting taking place regarding the local lockdown restrictions in Bangor and whether they need to be expanded further across other parts of the Gwynedd Council area. Wonder what your take on that was.
Well, we had a meeting on Friday and Saturday with colleagues from Gwynedd, not just the local authority, but also members of the local health service and indeed our advisor in Public Health Wales, the police and others. We're expecting a meeting with leaders from surrounding areas early this week, so within the next day or two, to understand whether we need to do more. And of course this depends on the picture locally within that part of Wales. It also is dependent on the picture across the whole of Wales. So there are a number of difficult choices to make about local, regional and national. And obviously when ministers have made choices, we'll not just need to decide, having consulted with local partners, whether they need to announce those and make clear to the whole country what any of those choices are. So we don't have a definitive decision today because those conversations aren't completed, and with the recent conversation just completed in Cobra, there's more we need to follow up, more certainty we need to understand about what support may or may not be available to help support choices that the Welsh Government makes to help keep Wales safe. Thank you, Dan. I've now got Andrew Forgrave from the Daily Post.
Good afternoon, Minister. Are you confident that Wales has adequate supplies of PPE for the coming winter?
Yes, I can be much more confident about the position we're in now compared to where we were in the middle of April, where I was deeply concerned about the position we had found ourselves in with a tightening of the international market for PPE, and at that point we hadn't got lots of our Welsh manufacturers in a position to make and create PPE of the right standard here in Wales. We're now in a different position where we've managed to re-secure supplies from international markets. We have a much bigger stock that we're holding here in Wales, and we also have that wide range of Welsh manufacturers who have really stepped up to the plate to act on behalf of the nation in creating new supplies of PPE manufactured locally. So we're in a better position, but as ever there's always a risk. There's always a risk about a virus where we don't understand exactly what the picture will be through the whole of this winter, but we're in a much more secure position than we were in the middle of April.
Thank you very much. NHS Wales had a reciprocal agreement with the NHS in England, which allows for bed sharing if capacity is adequate or sufficient. Given the severity of the COVID situation in places like Manchester and Merseyside, what is the likelihood of COVID patients from these areas being transferred into hospitals in, say, North Wales?
I think that's relatively unlikely, Andrew, because as we've heard from a previous question, in the northwest of England, they're getting ready to turn on Nightingale hospitals, as they're called in England. Their field hospitals are in North Wales, called Rainbow or Envis hospitals. So that's what's going to happen. They're going to increase capacity in England to deal with any potential impact if COVID does mean that the NHS might be overwhelmed. That's exactly what the field hospital programme is there for. Within Wales, we know that our own admissions are going up. We know that we're having to again step up and increase intensive care capacity here. So I'm not confident that we have capacity to take an overflow from England, hence why each nation has gone about creating that additional capacity. I've now got Dan Barnes from the South Wales Argus.
Thank you very much. Parents of children at Newport schools have recently been sent consent forms for online Zoom lessons. Does this mean that a circuit breaker lockdown of schools is on the cards, possibly for the autumn half term?
Well, we don't have a definitive plan at present, but as I've indicated openly and honestly, we're actively considering the choices we may need to make over the coming days. What should happen, though, is that regardless of that we know that schools should have in place plans for blended learning, which may mean that some people may be out of the school environment and may be learning from home. That means that schools should already be developing plans to make sure that they can actually provide that distance learning where it's required, whether it's for individual bubbles, for a whole year group, for a whole school group, depending on what may happen. And you've already seen, of course, within the Gwent area that the Argus reports on, that a number of schools about whether there needs to be a whole year group, that they haven't managed to isolate an individual class groups and bubbles within that year, and that's meant that some whole year groups have then been required to go home for 14 days. So actually, the approach on blended learning and making sure that distance learning requirements are in place is the right thing to be preparing for now, regardless of any choices we may or may not make on a fire break or a circuit breaker approach to trying to gain some control and buy some time to deal with the virus on a national level.
Thank you. And on Saturday night, there was a mass brawl in Killeen High Street after the pubs emptied at 10 o'clock. So will the 10 p.m. alcohol restrictions be subject to any kind of review?
Well, we regularly review all the measures we're taking, but I don't think people can use for drunken violence. Whether the licensing regime means that we close at 10 or 11, as I remember, when I was a young man, it was closing at 11 with drinking up time. And even then, there wasn't an excuse for people to go out on the street and to have a brawl. And even with later licensing hours, it's not an excuse for unlawful, violent conduct. All of us need to recognise that we all have a part to play. We're trying to keep a range of sectors open, including hospitality. That means that those businesses need to follow the rules in the way that they behave. It means that customers that want to use those businesses to enjoy what they have to offer also need to follow the rules and not look for an excuse to blame somebody else for our choices, but what we choose to do, whether that's 9 o'clock the point in the day. Thank you, Dan. I've now got Gareth Wynne-Williams from the Local Democracy Reporting Service.
Pnawn da. The latest 7-day rolling figures show Anglesey standing at 48.5 cases per 100,000 people, which is just short of the 50 figure which has been previously stated as potentially triggering localised restrictions. So although the figure is lower than neighbouring counties at the moment, what is the current situation for Anglesey, and have you discussed any specific measures for the island?
Well, as I said earlier, we're going to be having a meeting with leaders not just from Gwynedd but the wider area, including obviously Anglesey, early this week to understand not just a picture there, but to understand whether we do need to take additional measures. So we're seeing a small number of unlinked cases. We also understand a couple of clusters that TTP is on top of, but we need to understand not just the numbers and the data, because as you said, 50 is a potential trigger for action, but we need to understand the wider picture. When the island had the outbreak at Two Sisters, it had much higher rates per 100,000, but we were able to control and isolate that particular outbreak, and it didn't break into community transmission. But this is a good example of why we need to have a conversation about local, regional or national action, and to then understand how we have a set of measures in place the public can understand and support to help us regain some control over coronavirus, to both reduce the reproduction rate, but frankly it is also about reducing harm, to minimise the number of people that need hospital treatment, to minimise the number of people who may otherwise die over this winter.
And on the Bangor lockdown, it currently excludes part of the city, including the Pentir ward, which includes much of Penrose Gwynedd. This has been questioned by some local councillors who say it's causing confusion locally. How was the decision made to set the boundaries in the first place, and what's the situation regarding walk-in testing in the city?
Well, so two different things there. So on walk-in testing, we're looking to arrange more testing to be available in every part where we have a particular hotspot, and we'll have some plans for Bangor that the local services will be able to promote and share between them. So there'll be Public Health Wales, the North West Health Board, Gweinidog Iechyd, and also the local council to help people understand what is available. On your broader point about how the geographic location is set, well, it comes from proposals made by the incident management team for Gwynedd, who looked at the pattern of cases, and we then had a discussion on Friday and Saturday with the local authority involved directly as well. So we had the Chief Executive and the leader, Dyfrig Shenkin, in meetings with the First Minister, myself, and other statutory partners. And we went through to try to understand what would be the right sort of ward boundaries to set so people could understand what was included and wasn't. And this is part of the challenge. Whenever you set a border or a boundary, there is always going to be some concern about which side of that you are and how local community interactions work. But we did then check after we concluded our meeting on Friday that these were the appropriate ward boundaries to introduce these local restrictions. But as ever, this is always under review. It's why we're looking again at local, regional and national approaches, And this week, we'll need to make some choices about that. So it isn't just Bangor and Gwynedd. We're having to think about the whole country as well. As I say, this is all part of what we have to consider as we act together to keep Wales safe. Thank you, Gareth. I've now got Tom Magner at Carers World.
Thank you very much indeed, Minister. Good afternoon. The issue that's most worrying our viewers at the moment is about respite services. In any form of lockdown, it seems that you either shut down day centres and local authority home services, which ramps up the mental pressure on unpaid carers, or you keep them open and risk higher community transmission rates in more populated areas of Wales. Where do you stand on this critical issue?
Well, as ever, Tom, it's not a simple choice because as you've neatly encapsulated, there are consequences to making either choice. Consequences for carers needing to care for their loved ones if they're not able to access the respite and the activity that a day centre may provide. And there are consequences in closing those as well. And actually, it's a real concern for local authorities as well. In a call that I had last week, local authority representatives were generally concerned about the picture on day services and what they would be able to do and what they would want to do, because again, they recognise there is a balance of harm. That's why we need to understand what's happening locally. And then if we're taking a national choice, we need to be clear-sighted. There will be imperfections in doing so, but it's still fundamentally, Tom, about keeping your viewers and their loved ones as safe as possible and making a choice that drives down the R rate and keeps as many of us with the best prospect of being alive and well at the end of this pandemic.
Thank you for that. This morning, England's Deputy Chief Medical Officer, Professor Fantam, spoke of incremental creep of coronavirus from the 16 to 29-year age group towards older, more vulnerable people. How does that expert view influence your thinking?
We've had similar views and advice from our Chief Scientific Advisors on health, our Technical Advisory group that give us that scientific advice, and indeed our Chief Medical Officers Department. And part of the concern is that whilst we see much of the current rise in coronavirus is driven by contact between younger adults, it isn't exclusively younger adults. And we know that younger adults have contact with people in different age groups. And the concern is here that if we see a larger transmission rate, as we have done in some of our local authority areas, into groups of people who are above 40, 50 and 60, then we can expect there to be a greater likelihood of harm. And when we see hospitalisation rates, when we see those who need intensive care, we see sadly those people who are more likely to die from coronavirus, the further up the age range we go, the more likely that is to be the case. Now, that definitely plays into the concerns that we are having to consider and the choices that we may need to make. So it's okay, I'm only with people who are younger and fitter, like myself. Well, perhaps I'm a middle-aged man, so I may not be in that category anymore. But it is then about the consideration, the contact people have with other age groups or who are at much higher risk. And that definitely plays in to our choices. So that's why we say it's up to all of us to do our bit